Good evening. Welcome to the 10th week of Consider Us, the virtual series where we break down the science and public health of COVID-19. I'm Marianne McDowell.
Hi, and I'm Heidi Beidinger, and we're co-hosting this webinar series that's focused on the pandemic. And our guest today is going to be Dr. Robert Einters, and he's our health officer for the St. Joe County Health Department. And we'll introduce him shortly. But first, and as a reminder, our goal for this webinar has been and continues to be helping our community to understand the public health and the science of this pandemic.
So we hope you've been finding the information informative and are passing it on to others. Just to remind you, we also post tutorials, educational tutorials, and every week Heidi has a tutorial going over this week's data. So if you haven't looked at those, you can go back to the website and look at those. The one that I posted this week is about the vaccines that should be coming online pretty soon. So there's a lot of information there. And I want to remind you that the views that are presented in this series are mine and Heidi's and our guests, and not an explicit views of the University of Notre Dame. And any information that you might have should not be interpreted as specific medical advice.
So last week we had a terrific conversation about food insecurity in our community. Mary Jo Martinique from the Food Bank and Jim Conklin from Cultivate was here. Cultivate is a food rescue organization. Anyway, if you missed it, don't worry. As always, it is posted on our ThinkND page, and it had some really important messages about how the community can engage in what is happening in our community as it relates to food insecurity. So here we are now. We are in week 10 of our series. So woohoo! So let's introduce our guest, Bob Einters. We're going to cue the guest.
Yep. Yay, there he is.
Hello.
Hi, Bob.
Hi, Bob. Welcome. We're really, really excited to have you here so we can talk about public health and this pandemic. And Bob, I have a little bio here, just a little something about your background that I want to read for our audience. Dr. Einters was appointed the full-time health officer at the St. Joe County Health Department on February 17th. Of 2020. Dr. Einters retired from IU after more than 30 years on the faculty at IU School of Medicine as a Donald E. Brown Professor of Global Health and Associate Dean for Global Health at Indiana University School of Medicine, as well as the Director of the Indiana University Center for Global Health. He completed specialty training in internal medicine in 1984 and then served for 1 year as Chief Medical Resident at the Eskenazi Memorial Hospital. Dr. Einters worked as a volunteer physician in rural Haiti for 1 year in 86 and 87. And then in 89, he co-founded the Indiana University Moi University Kenya Partnership and served as the interim coordinator of the Department of Medicine at Moi University. Dr. Einters was the co-founder of the NIH-funded Moi Medical Informatics Fellowship and the principal investigator of numerous grants, including projects funded by the Gates Foundation and the President's Emergency Plan for AIDS Relief, also known as PEPFAR. My goodness, what a career!
Amazing.
Well, that was a mouthful. Thank you, Heidi. Thank you, Marianne. I'm really happy to be here and look forward to having the conversation.
Awesome.
Yeah, thank you so much for joining us. I'm particularly excited to hear what the public health situation is going on in our community. But before we get to that, based on Heidi's intro, hoping that you could give us an idea of how you got here, why you're doing what you're doing, why did you shift, a little bit about your career discernment, and Tony Fauci and Deborah Birx. I mean, it seems like you might, since they're HIV people. And then also a fun fact about yourself.
Yeah, well, I guess I would say if you appreciate the mask ordinance that we have here in St. Joe County, you can thank Heidi Beidinger and my wife, Leanne, for my being here. On the other hand, if you're not in favor with it, you can blame them for my being here. So I, as Heidi said, I retired from Indiana University just last year, and I was considering different opportunities around the country, quite frankly. Heidi and I met after a presentation that I gave down in Indianapolis, and Heidi said, well, would you consider moving to St. Joe County and being the health officer of St. Joe County? Well, true fact here, my fun fact, by the way, is that I have 8 sisters, and it's explained to their amount. But the true story is that my wife, that I personally was wanting to move to Mississippi because of a job I had had back there shortly in my college years. My wife vetoed that, and we decided that we would either consider Indianapolis or here in St. Joe County because we were married in Leidig, the little Methodist church out there. So that's how I ended up coming here. Obviously, there's a lot of parallels, a lot of overlap between global health and domestic public health. And I was keen to continue in that field. I certainly was looking forward to the opportunity to apply some of the lessons that I had learned in global health to domestic health, and the experiences I had in Indianapolis as a clinician and running a Westside Community Health Center there also were applicable to the job that I have now.
But now you don't have your AMPATH connection. You're not traveling as much. You wouldn't be anyway, I guess.
No, and thank God. This again, true story. Actually, early in my career, I would routinely have panic attacks while traveling on airplanes.
Oh,
Really? Oh
Yeah.
Gosh, because you were traveling a ton, Bob.
I've made over, I think over 120, 130 round trip visits to Kenya in the course of my career.
so you're going to miss those frequent flyer miles, I bet.
Yeah. No, if I never get on another plane, I'll be happy. My goal is to travel by car throughout the state of Indiana.
Oh, very, very nice.
That's awesome.
Good. I think we had some emails, didn't we, Heidi?
We did, totally. So to kick us off, why don't we take a couple of those? And these were actually, we're starting off with a couple of really fun emails that came directly from a few of your coworkers. So we're going to do the first one. You're going to love this. What cartoon character do you most identify with, and to which do you most aspire?
Well, I don't hardly watch cartoons. I would say, my wife would probably say that I identify most with Eeyore of Winnie the Pooh. My daughter would likely say the Grinch, because she recognizes kind of at the end of the Grinch, the Grinch has a big heart. And I perhaps aspired, I don't know if he's a cartoon character, but I guess I would aspire to be either Popeye or Iron Man.
Oh.
Those are both awesome. My kids would definitely go with Iron Man. Okay, and then number 2, they pose this question. What book is on your bedside table, or what book has, and maybe I'll put and what book has impacted you most?
Well, the books, I have several books that are on here in St. Joe, in South Bend. On my bedside, there are 2 books. One is the biography of Hamilton, Chernow's biography of Hamilton. And I'm about 3/4 of the way through it, but COVID has slowed my reading on that one. And then Dr. Seuss's Cat in the Hat. It's for my grandchild.
Oh, okay.
That's awesome. That's awesome. Okay, so let's move into Rumor Has It. So this is a little segment where Marianne and we talk to friends and family during the week, and then we pose the question, what rumors and myths are you hearing about COVID? And so this week, the rumor was the vaccine process is moving far too fast, and they are skipping important safety factors. Can we trust the vaccine? That's the question.
Well, it certainly is true that the vaccine process is moving very quickly from the basic science to the development, and now to the distribution. All this has moved very quickly, and it's to the credit of the scientific community and our leadership in Congress and the president for the speed with which this vaccine is moving. Many things are happening simultaneously. that in past vaccines did not happen simultaneously. But that said, the one area that the country has not in any way taken a shortcut is in safety. And so the National Institutes of Health leadership, FDA, the US FDA leadership have been working very closely with the pharmaceutical manufacturers of these various vaccines and ensuring that the safety profile is acceptable. And as I would guess most of us have been reading in the paper, the multiple phase trials, the first 3 phase trials now are all done, at least with the 2 messenger RNA vaccines, show great efficacy and really terrific safety as well, at least in the short term of a couple of months here.
Right, right. I had also read that that with the FDA, after each stage in the clinical process, you then go into a queue, that the study goes into a queue, and it can be a long queue and can take a really long time to get through that. But that with this process, obviously, they moved everybody to the first in the queue. And so now the wait times have been reduced, which has nothing to do with safety or efficacy, right? So I think these are things that we need to be sharing far and wide so that people become more comfortable with understanding what this process looked like.
And as well, there's, as you know, the post-marketing surveillance that will go on as well. And if adverse events happen, rare adverse events happen, we should be able to pick that up given the surveillance that is routinely done with all vaccines.
Yeah, yeah. All right, so let's talk about data for a moment, right? So, wow, okay, so there was a couple of big things that came out. There was an article that identified the 10 riskiest states not to visit the week after Thanksgiving, and spoiler alert, Indiana made the list. South Dakota was ranked #1 as the riskiest state, and Indiana was ranked #8. And then the article specified that 13.5% of all the COVID tests in Indiana are testing positive. And actually, it was just released by the health department today that we're actually now at 14%. Yeah, so we're north of even that state number. So obviously, we're not nearly out of the woods yet. And that CDC has been recommending that we restrict travel. And then they added that new guideline about actually wearing masks indoors. So that was also another headline that just came out. But then let's switch gears a little bit and talk about the public health data that was recently reported by the Kaiser Family Foundation as well as NPR. First, so I'll state them and then ask you to make a comment, Bob. First, some public health workers earn so little that they're actually qualifying for government assistance. This was found. And number 2, during the pandemic, many public health officials have found themselves disrespected, ignored, or even vilified. And NPR was reporting that at least 70 state and local public health leaders have announced their resignations, retirement, or even been fired in 20 states since April. And so obviously a little unsettling for, not a little, a lot unsettling. And I'm just, wondering maybe your comments about that or reflection.
Well, I've said for many, many, many years that health is politics, and it is, and particularly in public health, where we have a responsibility for many different responsibilities, but 2 of them are enforcement of certain statutes and public policy. And when one gets into making policy, clearly is not always just a bowl of cherries. It has been this pandemic, as we all realize, has become politicized, unfortunately. I think that the focus has been taken away from the virus as a pathogen, and unfortunately has devolved into at least had devolved into a political football that tended to further divide our country. as a result, we have seen just what you mentioned, Heidi, and it has been difficult for many individuals within public health. Up to the very top, we've seen the sort of criticism that even Fauci had to endure. Though the flip side is, it's also given public health a reason for existence that I think a lot of people perhaps fail to realize.
Yes.
So, I find this incredibly demoralizing. So not only has our country been gutting our public health infrastructure for the last 20 years, now people who, feel called to that service are, being vilified. It's really terrible. So have either of you, Heidi, in your role, or Bob in yours, either received threats or had people calling you names or disparaging remarks about you? You smile, so I'm guessing that's a yes.
Yeah, it is true. I have a brother-in-law who is in politics, a different party from mine, out in New Jersey, and he has shared with me periodically the sort of comments that he has been subject to. And I, of course, had never thought in my entire life would I ever have to endure the same sort of comments. But it is true. Individuals feel, not that they say this to my face, but they feel that they can write whatever it is whatever they're feeling at the moment. They feel it's an appropriate sentiment to share in writing. So we've received a number of comments that are disparaging. There have been an occasional threat, absolutely.
Wow.
And but that said, the public health is still a terrific field for young people to go into. It can make a huge difference.
Well, I certainly appreciate both of your service. How about you, Heidi? How do you handle it?
I used to handle it worse in the beginning. So it's interesting because frankly, before pre-COVID, nobody was even bothered with this little thing called the Board of Health at the St. Joe County Health Department. Yeah. And there were 7 of us and just kind of like doing our job. And it's all volunteer, by the way. There's no stipend, no payment or anything. It's volunteer. But then COVID came, and then suddenly, words and things were being hurled at us that, that were disparaging and very, very hurtful, because we come into the public health because we have this urge to care.
Yeah, it's not like you're making the big bucks or anything.
Not at all. You have this urge to care. And as I talk about in my weekly presentation, when we're tracking the COVID data together, we look at, as public health experts, we look at all the data, then we listen to our community, and then we make decisions. And that's what we're trying to do. And people should assume that we have that, assume goodwill. There's no malicious. We don't wake up in the morning going, oh, I just want to mess with the community. Let me just go out and start a mask ordinance. That's not the case. The case is, how do we keep our community as safe and healthy as possible? So, but you know what? It's colleagues like Bob that put a smile on my face and tell me that it's going to be all okay. So it's a good support system.
He definitely seems like a steady Eddie.
Yes, exactly.
Sorry, Bob, go ahead.
No, sorry, I interrupted you, Marianne. Just to follow up on what you were saying, Heidi, it is remarkable how individuals make these assumptions about us in positions of leadership. I'm speaking right now about Mark Fox and myself, since we tend to be more of the public face of our department. And they make assumptions that are so erroneous at times, and yet it causes I don't know that I would say it is so much hurtful as it is disappointing.
Right.
Yeah, because you're really having goodwill and trying to do your best and care for our fellow citizens.
Right.
Um,
Correct.
so that brings us to the headlines though, because Heidi mentioned the masks. But my first headline, actually we'll go to the second headline that I chose. It's a bit dated, but I thought since it's controversial, I was going to use it. And it was published November 23rd in the South Bend Tribune. And the title is Mask Fines to be a Little Sting for St. Joseph County Businesses. Here's how they'll work. So I was hoping you could give us a little background on deciding to have that ordinance. What were the arguments for, against, and why did it take so long to get passed?
Yeah, well, those are several questions. So if I go on too long, a soliloquy, stop me, interrupt.
Okay.
We don't have very many tools in our toolbox. Our armamentarium, if you will, to fight this disease is quite limited, and to this day still quite limited. Early on, when we were trying to understand what we could do to mitigate or to prevent the disease from taking hold, we of course considered face coverings. Initially, I did not believe face coverings worked. I looked particularly at the literature and the evidence coming from influenza, and I was looking specifically at the efficacy of, or the effectiveness of, the mask in protecting the wearer of the mask.
Right, yeah.
And the data for that was quite poor. And so initially I in fact was one of the many individuals who said there was no value in masks because we were looking at it simply from the perspective of say protecting the individual. But then over the course of several, actually looking back historically, and then also looking at the data at it and the evidence as it evolved early on in the pandemic, it became clear that the mask was in fact protective of your neighbor. If, in other words, anybody who wears a mask has a chance now to save somebody else's life. And so it was with the recognition that wearing the mask could prevent the spread of the disease that we then move forward with the ordinance, inclusive, of course, of physical distancing, hand sanitizer, hand washing, simple common sense measures. It did meet some resistance. It met resistance initially, I think, or even up to the current day, by kind of two different arguments. Two different cases were made against it. The first case was they just don't work. And I think a number of people were like me early on and simply didn't keep up with the literature, didn't find the literature initially, or the evidence, the scientific studies, if you will, and the epidemiological studies that showed that these masks really do decrease transmission. And that these studies came out from the basic science of it all the way to the epidemiology of it. And it just took some time for the evidence to accumulate. So there was that. There are still some individuals who are anchored to this notion that masks don't work. The other had to do with freedom. And so there was, as we all know, as being Americans, we value freedom very highly. And there was a sentiment among some individuals of, don't tread on me. And again, some of these individuals who felt that way didn't understand that the mask was used to protect other individuals and so I think those were the two arguments against it. I think we were very successful in the process of getting the ordinance accepted and passed by the county council and then by the commissioners. But again, it's a political process, and I think it was appropriate for the county councilmen, county council persons, and the commissioners to seek input, and for individuals in the community to give their input. Personally felt that it could have been done a lot more quickly, but the wheels of democracy sometimes move slowly.
What about this idea that the fines are going to pay for the health department?
The fines will not even pay for what it costs to do the inspections. The purpose of the ordinance all along was really, it was never about the fines, and it will never be about the fines. It's all about the messaging. And it was the Department of Health's effort to mobilize individuals in the community, particularly willing partners and opinion leaders and elected leaders, to understand and then to support face coverings, physical distancing, and hand sanitizer. I think without the support of the leadership and the elected leadership, it's very difficult to change behaviors. And clearly we were asking for very significant change in behaviors. And education in and of itself is an important piece of behavior change, but it's inadequate.
Yeah. Yeah, well, I for one am glad that it's been passed, because I think we're going to have to be doing it for quite a while, unfortunately. And that brings me to my next headline, which was published December 3rd in the Indy Star. Indiana is preparing to receive the COVID-19 vaccine. When will teachers get it? So the article is talking about the phased approach of who's going to get vaccines. And I thought you could maybe address that a little bit and what's going to happen in St. Joe County.
Well, it's important to recognize, Mary Ann, that I have to pull out my crystal ball to answer your question.
Okay.
And my crystal ball is no better than anyone else's crystal ball. In other words, there are a lot of moving parts even to this day, even to this day today, as it relates to rollout of the COVID vaccine. And so take everything I tell you, or most of what I tell you about the vaccine, with a little bit of a grain of salt. Specifically, I can't tell you right now, for example, when will teachers get it. But it is true that right now we're looking at a phased rollout of the vaccine. And right now, our best knowledge is about phase 1, and it's 1A and 1B. So in phase 1A, this is a vaccine that will be delivered specifically to the healthcare personnel, long-term care personnel, et cetera. And then in phase 1A, that vaccine is going to be distributed by, at least in this county, St. Joe Health System, Regional Health System, and in Elkhart County, it'll be by the Beacon Health System, and they then will be responsible for distributing it to healthcare personnel. And even there's going to be a phasing in with the people who are, if you will, at the most risk, people on the front lines will be getting the vaccine first. And then in phase 1B, the vaccine will be coming to a couple of different sources, one being the health department. And it's in phase 1B that we begin to deliver the vaccine and administer the vaccine, I should say, administer the vaccine to critical infrastructure workers. And exactly how that will roll out has not been clarified, but I would expect that phase 1B will start maybe late January, maybe February. It's a little bit hard, could be earlier January, but I don't think so. I think it's probably going to be late January, February.
So yeah, it depends on how much vaccine is available, how the transport and supply chain goes, and all of that, those issues. And what about, go ahead, Heidi.
I just had a follow-up question. So the way that the pandemic has been handled or responded to has been on a state-by-state cases. Is that the same with the vaccine? Will each state determine what their phasing looks like, or are we rolling out something that looks national?
Again, I'm not sure that question has been fully answered. Right now, it looks like, we're getting our marching orders from the state. And exactly what sort of communications the state is having with the federal government, I don't know. I can't answer that question. I'm not saying they're not getting it, but we do know that from the instructions that we have received and the information that we have received from state, that their intention then is to work through various providers at the county level. And so this seems to be, again, our marching orders right now coming from state, the state of Indiana.
Okay.
And do you know which vaccine will be in our county? All of them, or?
Well, right now, of course, the EUA, the emergency use authorization, is for Pfizer and Moderna, and those are the two that we'll be expecting. Our health department, we're expecting just Moderna in the health department for phase 1B.
All right.
And did I read we're all going to get little cards that are going to tell us which one we got and the date, so it's going to track it for us?
Yeah, that's exactly right. There's going to be a vaccine management system that we'll be using it throughout the state, using the vaccine management system. And individuals who receive the Moderna have to receive the Moderna. They can't receive the Pfizer the next go around. And so some of the nuances of this particular vaccine that we're not used to with other vaccines is that we have to keep track of that. The individual who gets the vaccine has to keep track of it. We have to plan for the booster dose, which is going to be 28 days later. And so from a scheduling perspective, it's more complex than what we would perhaps wish.
Do you know, are the states talking to each other and I mean, like, let's say I move to Ohio, in between my doses, are the two states going to talk their databases, or?
The data is all going into CHIRP. So
what is CHIRP?
Well, CHIRP is the Indiana database, if you will, repository. And could I tell you right now if Ohio can get into that with ease? I really don't know, but my guess would be that there is the ability to understand that. But I would think that the onus for getting the second vaccine is going to be on the individual patient with their card, as Heidi was talking about. And again, scheduling it, the idea here is if you're going to get it, Mary Ann, tomorrow, when you're here tomorrow, we're going to have your appointment 28 days later scheduled at that time. Or maybe even when you sign up, and you're going to do all this online, by the way, using what's called a Zotec registration system. When you go online to sign up to get your vaccine tomorrow, you'll also schedule it for 28 days from now. We actually don't have all of this worked out yet. And when I say we, it's the state and the county.
Can you talk a little bit about, is it going to cost people to get the vaccine?
No, it's not going to cost individuals. Insurances can be charged, Medicare can be charged $28 in administration fee. But individuals will get it at no cost, aside from time.
And so if you're saying insurance can be charged and they're not supposed to pass that on to the consumer.
Yeah, that's correct. That is correct.
So check your bills, everyone.
That's right.
Case.
Exactly.
But it does have a bit of a wrinkle. If we do these mass immunizations, it means we have to then collect insurance information as well. If we, the health department, charge, and even that we haven't figured out, can the health department charge, or is it your physician in the office if they happen to have the ability to administer the vaccine?
And just a quick follow-up, and then we can go to the question. Sorry, Heidi. Do you have enough staff on your payroll to help distribute these vaccines?
Well, the bigger question is, do we have enough staff to do public health in St. Joe County to begin with? We're going to need to rely on volunteers or paid staff, additional part-time staff, extra employees, if you will, is our anticipation at this point. Again, we don't really know how much we're going to get and when we're going to get it. And so if we only get enough to run, 1,000 in a week, well, maybe that won't require more staff. If, on the other hand, we can run through 10,000 in a week, then this means more points of dispensing, what we call pods, and will need more help. And we, in fact, now are in the process of collecting names and contact information for individuals who can help us with traffic control, help us with registration, and those who have the license to administer vaccines. And so the health department is looking for those individuals now.
So we'll follow
Another
up
call
with
to
you.
action. That's
Yeah.
right. We've been identifying that throughout this series, that there are lots of things that people can do to be engaged in this. So, you've already touched on it, Bob, that the health department serves a role in policy, enforcement, and so forth. But I thought maybe you could just take us back a few steps and let our audience know about this broader role of public health and the Department of Health in 2 or 3 minutes, about what does a Department of Health do? Why do we have these things?
Well, and again, I can't remember even now if I've mentioned it at the beginning or not, but the role of public health and the job of public health is encapsulated in that little tagline that goes with our mission, which is to promote health and prevent disease and to protect the citizenry of our community. And that's exactly what we do. And we're often known just for our inspections and our ability to meet the statutory requirements and the regulatory function of the county. But we do much, much more than that. And we think of health broadly. And as you all know, health starts, if you're waiting to address health when you're in the doctor's or in my office, as a clinician, we've waited too long. Health starts at home or in school or in the workplace and in various places in the community. And this is where the public health department needs to be engaged. And then we need to look broadly at health. We look at the health conditions. We do have a responsibility to prevent cardiovascular disease, to prevent cancer, to prevent adverse childhood experiences. And not only do we have the responsibility for helping to prevent that, but educating the public about that, working with our partners that are responsible for delivering services, be they preventive services, promotive services, or curative services, ensuring that at the end of the day, everybody in the county has an opportunity to achieve health. And I sound like a Bill and Melinda Gates Foundation, commercial here, but that's really what the public health department does, is enabling opportunities so that individuals in their journey for life, through their journey in life, can achieve the best possible health.
And just as a footnote, I want to let our audience know that Bob has crafted a strategic plan that's posted to the department's site, and he did that with his entire team there at the Department of Health. And so if folks are interested in learning just more in greater detail about some of the things that we're working on, it's posted on our website.
Well, yeah, I was going to just sort of follow up in the same way. Has the pandemic made it, can you actually do your regular public health job, or is the pandemic taken over everything?
Yeah, we have a terrific team in the Department of Health, and the 50 or so staff in the Department of Health have done a wonderful job, and I really do applaud them, and I hope that the citizenry and the community applauds them as well. It's been very difficult, and much of our work depends on meeting with the public and going in homes and doing inspections, and this carries a certain risk, of course, in this time of COVID. And they've done a terrific job. Have we been able to do it to the degree that we could do it, say, a year ago? Well, no. We've had to spend a lot of time on COVID, and a number of the staff members here in the department have had to work a significant amount of overtime just to meet just the demands of COVID. But they're a terrific team. We have very high caliber individuals working here within the department. They're very passionate, and they care about the people they serve.
So kind of going off of that, Bob, during this time of COVID, public health largely exists like sort of in the background or very quietly. And suddenly now we see you and Mark Fox in the news all the time, and you've been foisted to the epicenter of COVID. And so we're just wondering how that visibility and the expectations of the health department, how has that changed?
Well, it's a good question. Personally, I'm not one. I don't like being the public face. I've been so glad that Mark Fox has stepped up and done that job. Mark is a true gift to the people of St. Joseph County. He's very bright, got a terrific head on his shoulders, and has just made a right decision after right decision. He was here before I came on board. He was already the face, if you will, of our department as it relates to COVID, and he has continued to do a terrific job. Personally, I think I'd speak for him as well, though our preference would have been, we love to keep our sleeves rolled up, our heads down, and just doing the work. And I think that the work in and of itself should speak for itself and does speak for itself. Being more visible is a double-edged sword, Heidi. On the one hand, as we've talked about, it has caused some individuals to be fairly negative toward the department, and that's been unfortunate. On the other hand, it has demonstrated the role of the Department of Health, at least a role of the Department of Health. We have successfully worked with our partners, particularly through Unified Command, for example, with Beacon and St. Joe, South Bend Clinic, elected leaders, and the business community. And we've done, I think, a nice job of bringing all of these partners together under one roof and working for a common goal.
So can I just follow up, Bob? Is Unified Command all of those stakeholders that you just listed, or is that something different?
Yeah, sorry. Yeah, using shop speak here. Yeah, Unified Command is in fact Unified Command is the leadership that has come together under the leadership of the St. Joe County Department of Health to grapple with and find solutions to the COVID-19 pandemic, the SARS-CoV-2 pandemic. And it is, as I just mentioned, those three major healthcare delivery systems, the business community and elected officials. So Jeff Ray represents business community and elected officials. And then we have high level leadership from the various medical care delivery systems. And we were meeting every single day for the first several months of the pandemic. Now we meet every Monday, Wednesday, Friday, and discuss various issues.
And I might have missed it. So that's just St. Joe County. How do you communicate regularly with Elkhart County?
We certainly communicate with the surrounding counties, and the medical care delivery systems have a footprint in several of those counties, as you know. And so there is that communication, but it's not as regular or as codified, I guess, as what we have here in St. Joe County.
And I was just going to follow up to the follow-up. So was Unified Command, you said it wasn't codified in Elkhart County. Are there other Unified Commands in the state of Indiana? Or
yeah, okay. I don't know how they do it in Elkhart County. So, but in terms of, as we think of emergency preparedness and emergency response, this command structure is a structure that would exist in every county, and how they put it together would be perhaps a little bit different. Of course, here we have the two major healthcare delivery systems in that the hospitals, and South Bend Clinic as a primary care network. Marshall County would be a little bit different, and LaPorte County would be a little bit different. So they'd identify their leadership.
Got it. Okay. Awesome.
So I think we probably have time for maybe one more question or so, and then we probably need to do our Q&A from the
that sounds good. What about I think that, what if we talk just a moment about the CARES Act?
Yeah, perfect.
And talk about what is the CARES Act, and then tell us how the money's being used maybe in our community and the state of Indiana.
Well, the CARES Act is the Coronavirus Aid, Relief, and Economic Security or Economic Stimulus Act. I forget what the S stands for. And this is a couple $1 trillion package that was passed by the Congress and signed into law by the president. And it provides a stimulus and support for a number of different activities. I can't begin to know all of them. Our elected officials would know this better than I do. From my perspective within the Department of Health, it has funded testing sites. It's helped to fund contact tracing. It helps to fund some of the social safety net for any number of individuals, food, homeless, isolation and quarantine for the homeless. So various different unexpected or perhaps expected costs in an unexpected pandemic.
Yeah.
And so it's very important. I think the county received $8 million, of which $1 million or a bit over $1 million went to the Department of Health. The other 7 went to, 6 went to other entities, but again, all focused on fighting this pandemic and ensuring the safety of critical infrastructure workers, and the people that infrastructure serves.
Good. Thanks.
All right, so we've gotten several questions and comments. So thank you everybody for contributing. So the first one is from Alan, who asks, do participants in the vaccine trials wear masks while going about their normal routine? If so, wouldn't that skew the results somehow?
I have not seen the, I have not read the methods of the vaccine trial, but I am sure that those sorts of activities are controlled for in the analysis. And so yes, the answer is yes, they would skew, but they should be controlled for in the analysis.
Yeah.
So like in the statistical package.
Yeah.
I mean, I think in unfortunately, one good thing that's come out of the recent spike in cases is those vaccine trials ended earlier because there was more exposure.
I would say the other answer I would give to that question, though, would be because there were so many thousands of even if they didn't control for mask wearing, because there were so many thousands of individuals who were enrolled in that study, and because the effectiveness was so remarkable, we're talking 95% efficacy here. One would expect that or one would not expect that there would be so many individuals who received the vaccine because it was blinded, who then wore masks, for example, and those
Right.
who didn't receive the mask, didn't receive the vaccine, if you will, receive the placebo, were unmasked. That would be very, 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 very unlikely.
Yeah, can you just quickly follow up what you meant by blinded?
Oh, in that they didn't know if they, they were administered a vaccine, but didn't know if it was the COVID vaccine or the placebo.
Right. So that, yeah. So they wouldn't know for sure. And so not anybody who, oh, I got the vaccine, so I'm going to wear a mask kind of thing.
Right.
All right. So we have a question from Marie Donahue. Actually, she made a comment earlier that she is a nurse in St. Joe County and she will volunteer.
Send me your email, but I'll get it out. I'll figure out who you're supposed to send it to. But if you send me your email, I'd be happy to forward it on to the individual within my office who's creating the spreadsheet.
Absolutely.
That's awesome.
But she does also say, the Washington Post reported today that supply of vaccines is actually much lower than first anticipated. And can you comment on that a little bit?
Yeah, I can't comment with any more authority than what she has. I have heard the same that not just today, but last week that there was going to be not as much as we had anticipated. I think what this means is that the rollout of the vaccine will be slower, at least initially, than what we had originally hoped for and perhaps originally had anticipated. And among healthcare personnel, our sense from the communications I had with St. Joe and particularly St. Joe, that they're all taking that in stride. And we recognize that some of us will have to wait in line a little bit while others who are more at risk get their vaccine.
Right. And keep wearing our masks and social distancing while we're waiting in line.
These measures are going to be in place at least through March, and my guess is into April and May. And I would guess that not until the summertime will we be able to feel comfortable letting our guards down.
Yeah.
Yep.
So we have another question that probably either of you can answer this. And I have been confused about the figure of COVID test % positive, what that means. I've read that it can be difficult to interpret because it just might mean that not enough people are being tested.
Yeah, or it can mean that too many people are being tested. And so, for example, Notre Dame was just doing a lot of testing, and that's a population that had very low COVID positivity. And so, when we add the Notre Dame students into the positivity rate, it actually brings the rate of positivity down, because so many students are being entered in, students and faculty. Now, when all of those students went away, we lost that, if you will, denominator of COVID negative individuals. So our denominator became a bit smaller, and we still had the same amount of positive tests. And so it made the positive rate go up. And it's exactly what we saw. It's a little hard to tell, how much of it is a reflection of Notre Dame students moving away and how much is a bump after Thanksgiving.
Right.
It looks like it's a little bit of both.
No, Marianne, that would be a nice side by side that we could do for our last show.
Yeah.
To talk about that. I think that would be terrific. Yeah, it's a good question. Great question.
Yeah, and we actually have a question about that I'll address just at the end. So this one's actually maybe a bigger picture, and it's from Edward Kukla. And it says, do you feel the primary reason for the current public health failures is the anti-science movement of the political structure? I ask because I have also been threatened with arrest and incarceration for talking about the thermodynamics of climate change, which is not the same topic.
Mm.
This is purely conjecture on my part. But as I mentioned, I have 8 sisters. I actually have 4 brothers, or had 4 brothers, and we're split politically right down the aisle. And I have very conservative siblings, and I have very liberal siblings, and I straddle the two, I would contend. But
are you the middle child?
No, I'm number 3. But I don't think it's just anti-science. I think that anti-science plays a role here, but again, it became so political that it was politics that drove it. And another part was, I think there were a fair number of individuals in our country who really did feel that the old folks, your mom, my mom, your dad, the elders in our community have had their day, and if they die of COVID, that's okay. And if that's what it takes for the economy to keep moving, we accept that. And I think there are a number of individuals who had that sentiment as well. And I disagree with it. I can understand it to a degree, but.
Okay, yeah. I think I disagree too, but I get it. So I'm just gonna, it's a comment from Alan, and he says, your weekly presentations are fascinating. So thank you very much, Alan. And he's asking about if there's gonna be a report coming out of Notre Dame that describes the results of everything that Notre Dame did. And I'll just put a plug in for next week. We're gonna be hosting, the topic will be a summary of the semester. We'll be hosting Shannon Cullinan, the Executive Vice President of the university, and David Bailey, the Vice President of Strategic Planning and Institutional Research. And they were really instrumental in putting up everything at Notre Dame. So I'll just say chime in next week to hear all about that. And I think we need to get to our lightning round.
I think so. So this is the part, Bob, where we have just a little bit more fun and we get to learn something more about you. So I'll go with the first question. So what is your superpower?
I'm probably would be characterized as a renegade with a heart.
Renegade with an art. Awesome.
I like it. I like it. Okay, what about the last show you binged and loved?
Oh, that's easy. My 16-year-old daughter and I have been binging on the Marvel superheroes. We're watching them from the very first in order all the way to the last, and we've done 10 already, and I think we have 10 more to go. We
Oh my
love
gosh.
it. The two of us, it's our thing to do.
Oh, lovely.
That's awesome.
How do you get her? We try to twist my 15-year-old's arm to watch movies with her, and she does it very begrudgingly.
The third question, what is your most treasured possession?
Oh, that's my bicycle.
Yes.
We can see your
We can
helmet
see your helmet.
and your hand sanitizer in the back.
I guess I should say my reflector vest when I ride up my bike home tonight. So yeah.
Yeah. And what is your favorite meal?
Well, that'd be a tough one. It's either a cheeseburger or grilled cheese and a tomato soup.
Oh my gosh. And finally, what are you deeply grateful for right now?
Oh, that's easy, Heidi. That's my wife and my children.
Oh,
Oh, I always love that.
me too.
Thank you, Bob, so much for joining us. It was very informative, and I think the community will be very thankful that you joined us. And so everybody else, please share the information with your friends and family. And just to remind you, if you want to leave us any comments, you can email us at consider@nd.edu. Next week is our last week, so you only have one more chance to email us. And I will remind you that to join us next week if you're all about Notre Dame. And consider this, the more you know, the more good you can do.
So be informed and act on accurate information.
And share reliable information with others.
And until next week, be kind and let's give grace to each other. Good night. Bye.
Good night, everyone.
Thank you, Bob.
Thank you.
Thank you, Marianne. Nice job, Heidi. Nice job, Marianne. Take care.
Thanks. Bye.
Bye.
Bye.